important to talk about how important X-rays are and why they're so necessary to take periodically for patients. One thing that's a constant hot topic that I think there's a lot of misconceptions about and a lot of questions about just in general. So one thing that I like to tell patients and kind of give them a bird's eye view on is the fact that we can only see 40% of tooth surfaces when we physically do a clinical exam, because the other 60% of their teeth are either touching an adjacent tooth or it's buried in the gum and bone, right? So those are areas where disease typically happens. So cavities a lot of the times develop on those surfaces that touch the tooth next to it or on the tip of the root, right? And again, those early disease processes don't cause pain. So it is important that we take X-rays. For most people, it's annual. And for some people who have a super, super low decay rate, it might be a little longer than that. But I think one of the most common kind of concerns that we hear is about the radiation exposure that people get. So I do want to go through to kind of allay concerns about radiation and compare the level of radiation a person is exposed to in dental X-rays with some other common X-rays or things that patients might do on a day-to-day basis that they don't even know exposes them to radiation.
Yeah.
And I want to prompt with give them a perspective of radiation is measured in a specific unit called a millisievert. It's the unit of measurement used to quantify the effective dose of radiation that is absorbed by the body.
Yeah, so actually the maximum annual dose permitted for US radiation workers would be 50.
Okay.
So that's, that's on the higher end. So if we're looking at it compared to us, when we do a full set of X-rays, which is usually 18 to 20 films, depending, is 0.17.
Yeah.
So it's way down there. We actually get more radiation from living at sea level. Being here in Florida. I mean, we're definitely affected by that, and that is 0.3. So you can see how much less of radiation we're actually getting just from taking X-rays as opposed to living at sea level, which is very interesting. Also, another example would be if we just have to take one checkup X-ray where, we're looking at the root surface, and that's just one, and that would be 0.005.
Wow.
So that's way at the bottom of the chart, which is next to nothing.
I want to review kind of abdominal CT scans and chest CT scans are anywhere from 6 to 10 millisieverts. So the in dental X-rays, we're on the 0.0 something, you know what I mean, or 0.1 something, whereas this is hundreds of times that, for one chest X-ray, one abdominal X-ray. So it is a significant difference, especially with the advancements we have in digital radiography now. It's so incredibly low that it's really not a huge health concern at all.